We went for it today. We got a big meeting with a couple of really important topics. So not seeing any hands from the public, Chair Fletcher, I'll kick it over to you to begin our informational items. Thanks for joining us.
Yeah, thank you, DK. Thank you. It's good to see you. I miss seeing you in person. I used to see you all the time, but it's good to see you here. And thank you, everyone, for joining. In particular, to our wonderful District Attorney Summer Steffen for being here. I just wanted to come on for a few minutes and share with you a little bit of what is in the works and being planned around the shelter location proposed and moving forward on the county complex at Rosecrans. In the Midway area. I know that there will be questions and comments from folks, and so along with myself, we're very fortunate. This is a team effort, and a lot of folks are involved in this. And so we've got Barbara Jimenez from the county operations officer for our Department of Homeless Solutions and Equitable Communities. We have some behavioral health county staff who are here with us as well. Hafsa is here from the city, Director of Homeless Strategies and Solutions. Lisa Jones from the Housing Commission, and Drew Mosier from the Lucky Duck Foundation. And all of us together are coming together to try and meet what we have been told is a need, in particular in the Midway area, in particular in Rosecrans, at times urgent need for some sheltering capacity so that we can get some people off the streets and get them into services. And I know folks throughout Midway are very frustrated with the situation there, and I understand that. And it has driven us to a point where we are acting in response to a lot of the concerns we've heard. I've also been doing this long enough to know that folks may be both simultaneously demanding action on homeless and simultaneously concerned about locations or how a thing will work. And so we're really here to kind of walk through what we're doing, what is in mind, what is intended, why we think it'll be good from the community, and then also hear from folks' input as we move forward on this proposal. I really want to thank the Lucky Duck Foundation, Dan Shea and Peter Seiler and Drew, who are here today. They have a sprung structure, a hardened structure that was in use for a while, and then the previous administration at the city took it down from where it was. Another city was going to take it. They ended up not taking it. And when we see such an urgent need on our streets, to know that we have a facility that can house up to 150 people sitting in storage with a nonprofit that is willing to not only not charge us for the structure, but also willing to pay to set it up, was an offer that I felt like we needed to really move forward on. And so working with the city, with the Housing Commission, with our behavioral health services team, we really identified this location because, one, as I mentioned earlier, it meets a community need, a community that has a really serious problem of chronic and long-term homelessness, but also in particular because of its literally adjacency to the psych hospital in Rosecrans. And I know there's been a lot of frustration with folks perhaps being discharged from there with nowhere to go and joining the area. And so we have worked collaboratively with the mayor, with Councilmember Campbell. Supervisor Lawson Reamer will be inheriting this area of San Diego with the new redistricting coming forward. When we started this, it was in my district. Redistricting shuffled us as well, but District 3 and Supervisor Lawson Reamer have been very helpful to this. But it'll be a low barrier, just-in-time emergency shelter for individuals who have otherwise not been able to access a place to stay. And the key, I think, is that in addition to the standard kind of portfolio of shelter services, this facility will provide access to on-site behavioral health care assessments, to care coordination and connections to a variety of community resources that are made available through the county behavioral health department. In fact, behavioral health will be on site to provide these services, making them easier to access, to help create the relationships and the keys to trying to get people into long-term successful outcomes. And we think that this will work well. Obviously, we've moved forward with the high need individuals in our community harm reduction shelters. And this is not designed for that population. But this is designed to get people off the streets and get them into a transition into a permanent solution and into permanent housing. The Housing Commission has specifically created a position of coordinator to ensure people who exit have transportation and ways. The city is obviously a deep attached together partner who's contributing significant funding to help ensure the operations and security of this, and then Lucky Duck again has a role. So, we've got a whole bunch of partners here. City of San Diego Housing Commission, they're going to be in charge of the shelter operations, which is 24/7, including referrals, intake, service coordination, security, meals, hygiene, and cleaning. They're also going to lean into housing, as the shelter is meant to be a short-term solution to these clients in transitioning to the most appropriate long-term or permanent supporting housing opportunities. City and Housing Commission will also be responsible for transportation services, showers, restrooms, laundry, security, and ongoing maintenance. As a county, we are giving up the land on our property there in Rosecrans. We will also be providing behavioral health services. We're doing a lot of site improvements on the land, and that, along with the screening, assessment, on-site behavioral health services, the public health education and screenings, and we will have human services specialists there to help sign people up and connect them to self-sufficiency resources. And then Lucky Duck, our wonderful partner, is donating the use of the shelter structure and also the construction of the structure today. We're not here today to tell you that this one shelter, 150 bed, is going to solve homelessness in San Diego. We are acutely aware that the root cause of homelessness is poverty. And the only way to make substantive progress on this very complicated issue is to tackle the root cause and try and stop people that are sliding into homelessness, while we do everything we can to get as many people off the streets and connected to ongoing services. And so, we think this is a positive direction. We obviously, I know and understand, folks are always, again, both simultaneously concerned about unsheltered folks who are in their community, and at times can also have concerns about attempts to get them off the streets and into shelter. And we want to be sensitive to that and aware of that, while also, understanding the tremendous obligation we have to need to act to be able to help alleviate the condition in our streets. But with that, I want to kick it over to a few of our partners who are going to provide a little update and share a little bit about this. First, I want to introduce Hafsa, who's Mayor Gloria's Director of Homeless Strategies and Solutions, who can speak about it a little bit. Hafsa?
Thank you, Chair Fletcher, and that was such a great synopsis of all the incredible work. DK, I just want to say thank you so much for bringing everyone together, and I echo Chair Fletcher's sentiments on all the incredible partners that he listed. We are so grateful for everyone's work. One of the things that Mayor Gloria has done is help elevate the Homeless Strategies and Solutions Department to help support the work that we are seeing today happening. The internal coordination, the external coordination, it takes a lot of bandwidth, capacity, and technical assistance to help bring people together and to help go ahead and move forward on these new initiatives. And so with that being said, I just do want to be able to say, what are some of the key points on how this impacts the overarching strategy, right? So the overarching strategy is housing first. And as Chair Fletcher mentioned, leading in with the Housing Commission, we want to be able to continue move people into permanent housing, affordable housing, but shelter is also a way to get people immediately off the street, which also impacts the quality of life that we see across the board. The best way to help that person who's on the street, on the curb, get off and into permanent housing can be through the nexus of shelter. And we're really excited that the county is leaning in from the support of behavioral health services. We know that has been a huge impact in the population that are being served, and we want to be able to ensure that there is that added support. So we're very grateful for that as well. Another piece that I did want to mention is this really aligns with the community action plan that our council had adopted back in 2019. And that is something that we've all been working collectively together with all the partners on this call, is making sure that we are decreasing the unsheltered population. And this is how we do it. And this is how we do it quickly and expeditiously. So as I mentioned, I think some of the major components that meets the strategies across the board is housing first, is meeting the objectives of our community action plan one by one, through shelter, through outreach, through permanent housing, through the supportive services, wraparound supportive services. And then also this meets the Matthew Doherty recommendations that the city adopted as well, in terms of really strengthening the internal collaboration. This is a huge project, and we're so grateful for the philanthropy work as well of Lucky Duck partners, and we're bringing all of it together from all of the stakeholders to go ahead and launch and get people off the street. So with Chair Fletcher, I'll put that back to you. And I also have, Lisa is also on the call here, who's critical as it's relative to the operations. So if there's anything else you'd like to add, or we could wait for the question.
Yeah, perfect. Thank you so much, Austin. Again, thank you to the city. This really has been a team effort and a joint effort, and we appreciate that. So, DK, let me kick it back to you. We're happy to open up for questions, comments, thoughts. We got a whole team of folks that are here who can most appropriately jump in and answer questions or provide insights, whatever works best.
Awesome. Well, thank you very much, both Chair Fletcher and Hafsa from the mayor's office. I think we'll start with board questions and comments, right? So if you're a member of the board of our planning group and you'd like to ask a question or follow up, now's the time. I'd say go ahead and raise your hand or come off mute, and then we'll go over to the general public. But right now I'm calling for board questions, comments, responses to what we've just heard. Is there anyone from the group? Okay, not hearing anything from the group. If there is anyone from the general public, I'd say now is a good time to go ahead and raise your hand, and we're happy to acknowledge you and facilitate this conversation. I know that at least for me, I can kind of maybe warm us up. To your point, Chair Fletcher, this has been an ongoing conversation that we've had in this community for a long time. You know, we spend a lot of time as a planning group trying to do what we can to improve our conditions, frankly. The encampment down Sports Center Boulevard, you know, I think that's obviously something that's gotten a lot of attention over the last few years now at this point. Can you talk a little bit more just about how you aim to actually, I don't think recruit is the right word, but populate the shelter, right? Where are these folks going to be coming from, and what is it exactly that we see from a flow standpoint, right? How long do you anticipate folks staying at the shelter? Yeah. Ultimately, what's that transition plan to ultimately, you know, help these folks out?
Yeah, I will. I'm going to kick it here both to Hafsa and perhaps Barbara Jimenez, who may want to weigh in on this. And, you know, the reality is, you know, there are more than 150 unsheltered folks in the Midway area. And, you know, some of those folks, again, we have outreach workers and teams that go out and are designed to help facilitate and get people in here. And again, obviously, a shelter solves sleep, right? Housing solves homelessness. We know that, we understand that. But we also know that this is the first place. You get them indoors, you get them in shelter, you get them connected to services, and it makes it exponentially easier to get them into that permanent home-based situation. So let me go to Hafsa and Barbara if you want to talk about any of the kind of outreach efforts, kind of ideal timelines for how long people would be there, all of those types of things. It's a really good question.
That's a great question. And I'll shortly punt it to Barbara here because I know about the incredible work that the county's doing to do the outreach. I will say that with the Housing Commission and our providers, we have a very robust coordinated outreach team, and they're constantly hitting the streets, pounding the pavements to make sure that there is established rapport to get people into shelter or even permanent options as quick as possible. So DK, I think one of the things that I'd like to mention to that question is also the priority of hearing folks that have lived experience, right? This is a national best practice. And when our teams are out there, we're asking them, what is going to work? What do you need? How could we be more supportive? And so hearing that this is also supported by lived experience persons, that also is huge as it's relative to getting folks off the streets. And Barbara, hunting to you.
Yeah, you guys both did, of course, an amazing job of covering it. The outreach is critical. Getting to know and engaging with individuals is really important, and having the full array of resources available, right? So if someone is a veteran and we need to connect them to the veteran services and possible VASH housing, things of that nature. So outreach, consistently working together is huge, and that's what we'll be focusing on.
I'll just add to that too. And I think to the point about the conversation around the sort of encampment in the sports arena area, there's been a lot of work with the outreach teams over the last several months, really working on building those relationships, both from the C-Heart team, but also from the city's coordinated outreach team. And those teams are neighborhood based. So they stay in those same neighborhoods, building those relationships over time. So knowing that this is coming is definitely going to be part of their work going forward. And I think the other thing, really hearing to Hafsa's point, persons with lived experience and from the outreach teams themselves, is that being able to accommodate, and Chair Fletcher mentioned this, 24-hour intakes. So when someone decides, okay, it's 10:30 at night, I'm done tonight, I want a place to stay, we can accommodate that. So that the model that we're building out in this shelter is a little different, to be really low barrier and to be more accommodating to meet people where they are in that moment. Because there's something to sort of that critical time intervention where this is the moment that I'm saying yes, and then being able to have the resources in place to accommodate that. both from an outreach standpoint and from the shelter standpoint is important. So we built that into that. And I think that in particular with some of the populations you see down in your own neighborhoods in the community there, it's going to be an effective approach in getting people to engage where they might not have before.
Thank you.
Cool.
Thank you.
Thank you.
Thank you.
Chair Fletcher, sorry, go on.
No, that was good. I was just thinking of, we were both thinking of.
There we go. There we go. I think for me, I'm just sort of brainstorming here, but when we talk about these shelters, you'd mentioned a date that this is anticipated to open. Can you refresh me on when you anticipate opening?
Yeah, we're aiming for the beginning of July. Is when we're aiming to have it up. It may fluctuate a little bit, but we're moving as quick as we can. There was a lot of site improvements we had to do to make the site ready and able, and power and water and kind of all of those components, and getting the structure up, and then getting the service providers on board and ready to staff it.
Okay. And so will we have an update that's definitive, I suppose, before this does actually open?
Yeah, right now it's as soon as we possibly can, early July, but we absolutely, DK, as we get honed in on an actual date, we will absolutely let you all know. When we expect, and then, we can share timelines. Is it going to be kind of a soft opening? We're going to bring it part capacity, full capacity, we'll just keep you posted on all of that as we go. I think the need is so urgent and so great. We are trying to move with a sense of urgency, recognizing we got to do it right. I mean, this is not something that you just sloppily throw together and have it not, be good to do this and do it right. And again, the goal would be, other than seeing a large structure right there, the surrounding communities wouldn't really know what was happening, except there'd be a lot fewer people on the streets in that area.
Mm-hmm. And I guess, to that effect is what mechanisms or methods you're using to measure your success and progress. And, in the event that those of us in the community do see changes that we'd like to incorporate our feedback to, how does that whole work out?
Yeah, let me kick it to Hafsa and Barbara on kind of how we measure kind of transition, permanent supportive placements, how many people come in here and arrive at a thing, length of stays, kind of some of those metrics we look at for its success. And then in terms of ongoing engagement, I mean, I think it's got to be an ongoing conversation. As issues pop up, we've got to hear them. We've got to figure out how we can address them and work through them. And so I really view that as an ongoing, every month throughout the duration, of this, a kind of ongoing accessibility and openness that we have to make sure we're listening to the community, to make sure we're doing it right. But let me go to Hafsa and Barbara or Lisa, anyone who wants to jump in on kind of general shelter operations and how you assess their relative success and accountability.
Yeah, I think that and DK, that's an excellent question. And that really speaks to another priority that Mayor Gloria has in collaboration with all the partners here in the county, is really looking at a data-driven approach, right? Making sure that data is at the forefront. And so two things that's very unique and beautiful about this project is that there have been constant coordination and weekly meetings with several of the partners here, from the experts on boots on the ground, and those who are working within the site planning too, to make sure that there is all I's are dotted and T's are crossed. So for example, when we're looking at data, we're looking at how can we quickly get people off the street as soon as possible? How could we quickly get them into the shelter and then also connect them to the supportive services? How can there also be a nexus of finding out if people already have housing attached and where is the crack in the system for them? And that's the case management. So, I think Barbara has been in those calls as well, her team, Cecily and folks, Lisa, and, we hope to have a dashboard. I certainly would love to see a dashboard regarding this. I know Lisa and the Housing Commission is working through that, but I, would want to open it up if you want to add additional to those reference points.
Absolutely. Barbara, do you want to jump in or shall I?
Go ahead, and then I can go after you.
Okay. You got too many people on here that have information they can share, right? So I will say, just from just sort of like a communications and circling back perspective, DK, I think you and the board know that since the harm reduction shelter started, I've been coming on every month to provide updates. I absolutely commit to continue to join monthly and to bring those updates into this space as well. All of these agencies, the county, the commission, the city, BHS, and then of course the operators generally meet weekly on these projects. And so when I come forward to you, I always make sure that that's inclusive of those updates as well. So we'll continue to do that. But from sort of like a success standpoint, I see success in a couple ways. And from a community perspective, one of the biggest successes is it helping getting folks off of the street in your community? Obviously, that's a success in itself. But also when people choose, and Chair Fletcher spoke to this really, really keenly, but also when people come, we do know that sometimes people don't stay in shelter, right? We do know that people come into shelter, they exit out. So as bearing that in mind in the conversations that the planning group has shared with our leadership to date, one of the things we did is also build in engagement positions that for someone who exits the shelter but doesn't exit to that next step, like they just decide to leave, their goal of those engagement positions is to go out into the community and make sure that we are re-engaging them, either getting them back into shelter, or to be really frank with you, if they don't want to go back into shelter, to transport them to wherever they want to go. Because if they didn't come from your community, then they likely came from a place where they have supports and they feel connected. People tend to have a geographic home, even if it's not a traditional home that we think of, where their support network is. So we very intentionally built in engagement resources as part of that to make sure that not only are we doing a good job to target the folks in your community to come into shelter, but if people exit not to housing or not to the next thing, that they are not then becoming impactful in your community. We are working with them still to get them to that next step, whatever that is, even if it's not that shelter environment. So that I think is a really positive outcome that we want to track and get feedback on from the community. And then of course, the big outcomes, to everybody's point, are always who's getting into a longer term housing resource, who's getting into a permanent housing resource. And longer term might mean a residential treatment facility. It might mean adult independent living care. It might mean a variety of different options that best meets those people's needs at the time. So we're working collectively on how we can collect that data and report out on that as well.
I would just add, Lisa, that from the behavioral health services perspective, we are looking at all of those measures in addition to, for us, connection to services that people may be interested in receiving and qualifying for. And in the event that folks fall out of shelter, if they leave the shelter, that will not mean that they necessarily have left treatment services. So our work is to make sure that they stay engaged in the services that they're connected to, whether that, to Lisa's point, be residential services or outpatient services. Our focus is really the underlying issues that can be associated with both homelessness in general, but also with just the difficult lives that these folks have living on the streets. So in tandem, working alongside the city and with the Housing Commission collectively, we really have a very robust measurements in place to make sure that this is a success, and specifically for the people that we're serving. So not only for the community, but for the people that we're serving, making sure that we're making a difference and connecting them to the services that they need.
Awesome, thank you. And Lisa, you mentioned the fact that you've been here religiously, frankly, for the last year now or so. And one, I'd like to say I appreciate that. And two, you've set the expectation, you've set the bar for attendance and for representation. And so I'm encouraged to see that you're continuing to be here. I'm encouraged to see sort of the camaraderie and I think the teamwork and the partnership, frankly, between all these different agencies. And I would like to just kind of underscore and say, as I call one more last time for any other questions or comments from the board or the public, I think it's really important that we continue this conversation. So there's a question in the chat from Christine saying, where will these metrics be posted publicly? Which I think is a good question. Will they be posted somewhere publicly? And if so, where?
So we do have dashboards on our website that post about programs, how shelter is performing, how rapid rehousing is performing, how permanent supportive housing, how outreach are performing. We don't have them down to the program level, but that's certainly something that we can come back and share. Like I said, we are all collectively identifying what we want to make sure we are elevating as far as outcomes. And we have a working group that's working on that right now. I see everybody nodding. So, but we can also come back and make sure that that is publicly made available through our monthly check-ins too with your team.
Cool, thank you.
And
okay.
DK, I want to thank, I want to thank you. I want to thank everyone involved. Look, it's the problem is great, but in so many communities that the solution becomes very evasive in terms of its people say, hey, deal with homelessness, but then a long line of folks opposing any effort. We know we've got an obligation collectively to make sure we do this right. to make sure that it is run safely and securely and it provides good services. And we're going to live up to our obligation on this. But, you know, we really appreciate everyone's work in getting us to this point and support of the efforts. You know, we know homelessness is a problem across the entire county, but we know it's particularly acute in the Midway area and in the Rosecrans issue. And so we're here to try and make a difference and show progress. And so, you know, continue dialogue and engagement as we move forward. But, you know, appreciate the opportunity to join you all and talk, and we will certainly be on hand to come back as we move forward.
Yeah, no, I appreciate it very much. And as you said, this is an ongoing conversation. So you know where to
Yep.
find us, we know where to find you, and we'll certainly continue. We'll continue this whole process. So thank you. And
Thank you.
now